I am the Communications Director for Prince George's County Executive Angela Alsobrooks. We'd like to thank you all for joining us. As you know, we're entering the holiday season, and so the County Executive has brought us together to be able to disseminate some critical information, both from the government as well as the school system. So first, we'll hear from our County Executive, followed by Health Officer Dr. Ernest Carter, and then Prince George's County PGCPS CEO Dr. Monica Goldson.
Good morning, Prince Georgians. I wanted to come out to provide a COVID-19 update and assure all of you that we are taking every precaution necessary to keep you safe as we see the spread of the Omicron variant in our community. I'm joined today by Dr. Ernest Carter. I want to thank him for being here and to thank him for his tremendous leadership. He's going to discuss this variant and talk also a bit about the studies that support getting a booster shot to protect yourself. I am also really pleased to be joined by our public school CEO, Dr. Monica Goldson. I want to thank Dr. Goldson also for her truly outstanding leadership during the course of this pandemic and beyond. And she will be able to provide an update for you as well regarding our school system. Before I go any further, I do just want to take a moment to reflect a bit on where we have been during the course of this global pandemic. For 2 years, COVID-19 has made its way around the globe. In that time, our lives have changed more than any 2-year period in living memory. We want to I certainly want to compliment Prince Georgians who have done an absolutely amazing job during the course of this entire pandemic, who have really cared for each other, have been sacrificial, have listened to the advice of all of our health officers, and they have just done a yeoman's job. Because of that, we have one of the highest vaccination rates in the state, and this is due to the willingness of Prince Georgians to roll up their sleeves to protect themselves and those around them. And so I want to thank them so much for that. We truly fought this pandemic unlike any other jurisdiction. I have to say we fought it with one hand tied behind our backs. And this was because of all of the inequities we faced and the comorbidities that made our residents sicker and more vulnerable to this new virus. However, to no surprise, I was not surprised at all to find that Prince Georgians, who no one should ever bet against, came together in ways that none of us ever even knew were possible to make sure that we were caring for each other as a community, and for that I will be forever grateful. And through your collective efforts, we went from being the county with the highest infection rate in the state to a county that has consistently had one of the lowest infection rates in the state over the last few months. And while the state data was being reported, this is a monumental shift, and it's because of you that it was possible. Now, the new COVID-19 variant of concern, Omicron, is spreading rapidly around the globe and in the United States. But there is good news. For one, it seems that the vaccines, particularly the booster shots, we're hearing have been particularly effective at reducing the severity of this new variant. And if you have already not done so, it is time to get vaccinated against COVID-19. To get your booster shot also if you've already been vaccinated. Most of our neighbors and friends here are already vaccinated, and we ask you to please join the majority of Prince Georgians who are proud to be protected against COVID-19. As I mentioned, our collective work as a community helped reduce infection rates and case rates over the summer and into the fall. Again, we went from having the highest infection rate in the state to having one of the lowest. Unfortunately, as you are aware, the state's COVID-19 tracking data was not updated for several weeks due to a cyber attack. Yesterday, they started reporting again on statewide data, and what we know is that Maryland has experienced an increase of 28,341 cases since December 3rd. Additionally, the positivity rate in the state went from 5.4% on December 3rd to nearly 10.3% yesterday, which is an 89% increase in just over 2 weeks. This, I don't have to tell you, is extremely concerning, and we know that the surge is a statewide surge. However, we still do not have countywide or county level data And we hope that this access will be restored very soon, so that we can have a more full understanding of how the virus is impacting our county. In the meanwhile, we've been looking to our neighbors across the region, and we believe that this information helps us to infer what the infection rate is here. Based on the last year and a half, we're confident that if our neighbors are experiencing a spike in case rates, then we probably are experiencing a spike as well. And so we've been looking at data not only here in Prince George's County to help us fill in the picture, but we've been successful in also charting what's happening around the region in Washington, D.C., Virginia, and other places to help us to gather the data that's necessary. And so we do have data from our neighbors that we can look to, and it shows a concerning trend across the region. In D.C., 1 month ago, on November 20th, the weekly case rate per 100,000 residents was under 100 cases. Now, 1 month later, it's at 356 cases. In Fairfax County, 1 month ago, on November 20th, the weekly case rate per 100,000 residents was 63 cases. Now, 1 month later, it's over 160 cases. In Alexandria, 1 month ago, on November 20th, we know that the weekly case rate per 100,000 residents was at 77 cases. Now, 1 month later, it's over 280 cases. So we know that jurisdictions across our region are experiencing a surge in cases over this last month. And based on all of this, we know also that Prince George's County is certainly experiencing a surge as well. And so we need all of our residents, again, to please get vaccinated. If you are already vaccinated, get boosted. And we ask furthermore that you also get tested as the holidays approach us. In terms of vaccination rates, as I mentioned, we have one of the highest vaccination rates in the state, and it's thanks to the hard work of our residents. Over 78% of adults 18 or older are already fully vaccinated against COVID-19. When including everyone over the age of 5, 72% of our residents are fully vaccinated. And finally, almost 90% of our seniors are fully vaccinated right now. So we've made tremendous progress in getting residents vaccinated, and we're so proud of everyone who has helped to roll up their sleeves to make sure that this happened. So if you've not been vaccinated, please do so as soon as possible, especially as we face this ongoing surge that is happening and we expect to happen during the course of the holidays. That includes our children 5 years old and older. Last month, vaccinations were approved for children between the ages of 5 and 11 years old, and we want to be sure that we are protecting some of our most vulnerable residents, and among those are our precious children. And the vaccine is the best protection we have against COVID-19. And so I'm asking parents, please, if you have not done so already, please make sure that your kids are vaccinated against COVID-19. With the introduction of the Omicron variant, it is now more important than ever that individuals who have already been vaccinated go ahead and get the booster shot. Dr. Carter will talk about this a little bit more in a minute, but what we know is that studies show us that we are consistently finding that the booster shot offers the best protection against severe illness. Booster shots are available for anyone 16 and older, although if you are 16 or 17, you can only get a booster shot of Pfizer. And this is because this is the only vaccine that has been approved so far for anyone under the age of 18. For Pfizer and Moderna, you should get a booster shot 6 months after your second dose. And if you've gotten the Johnson & Johnson vaccine, the CDC is recommending that you go ahead and get your booster within 2 months of having gotten that shot. Please remember that mixing and matching vaccines for a booster is entirely fine. This has been approved by the FDA and the CDC. So if you received one brand of vaccine already initially, you can choose to get the same brand for your booster, or you can choose to get a different brand from that you originally received. Either way, as soon as you're eligible, please get a booster shot. You can schedule an appointment at a number of pharmacies already, your doctor's office or community sites, and you can also schedule an appointment or walk-in to our health department clinic at the community college. You can find a vaccine site located on our vaccine webpage, and that address is mypgc.us/COVID vaccine. Again, that's mypgc.us/COVID vaccine. We need as much protection as possible from this variant, and everyone getting a booster shot will help us to fight in the next wave of cases that we're beginning to see. Finally, as we rapidly approach the holidays, I want to remind our residents that we must continue to take precautions to protect against COVID-19. At this time, I am urging Prince Georgians, please exercise caution with family gatherings this Christmas and over the holiday, New Year's. With the surge in cases that we're experiencing, I ask you to please consider a more intimate setting with vaccinated family and close friends. And I'm simply asking, just use your best judgment in terms of gathering. We know that people are excited, have made preparations to be together during this holiday season, but we just ask you, please use your best judgment and make the best decision that you can for you and for your family members in order that everyone should be protected and safe and healthy as the holiday season progresses. We also encourage individuals, if you are approaching these family gatherings, please get tested. Testing is still an effective way to prevent the spread of COVID-19 in our community. And our county health department is still offering community testing, and this is free testing. You can go by the Bunker Hill Fire Station to receive that free test. You can also get a test there. The testing hours are Monday through Friday from 9:30 a.m. until 5:30 p.m. The testing site will be open December 24th and 31st from 9 a.m. to 2 p.m. And we also have partner testing sites at First United Methodist Church of Hyattsville, Rosier Medical Center in Laurel, and the state is also operating a testing site at the City of Praise Family Ministries in Landover. There are also local pharmacies, urgent care, and other healthcare providers who are offering testing to our community. We have a testing site locator on our county website for anyone who's wondering how to find the closest site to you. You can just go to the testing site locator at health.mypgc.us/COVID testing. Again, health.mypgc.us/COVID testing. And if you're traveling or planning to gather over the holiday with family and friends, or if you're experiencing symptoms of COVID-19, please get tested. We want to make sure that we can protect our loved ones during this holiday season and slow the spread of the virus through our community. Finally, I want to remind you all about the mask mandate that is in place. We know that wearing masks can help protect us and slow the spread of the virus. We know this as a matter of fact now, that this has been especially effective for us here in Prince George's. And so if you're indoors at any public venue, please remember to wear your mask. Wearing a mask plus getting vaccinated and boosted and getting tested, well, these are the best tools that we have to slow the spread of this virus. And we know these things work, and we must do everything we can to continue to care for each other. I know it has been a while. We've been talking about this now for close to 2 years, but I just ask you all to please hang in there with us a little longer. And again, Prince Georgians have done an absolutely beautiful job to go from the highest infection rate to one of the lowest infection rates in the state for the last several months is really due to your diligence and your vigilance, and we just ask you to continue. And then before I hand it over to Dr. Carter, who will give us a health update, I also just want to say to all Prince Georgians to please have an absolutely amazing holiday season, that I wish from my family to yours, that you will have a safe holiday and a happy holiday. Just really sending blessings to all of you all. May God bless you all in the holiday season. And now I'll turn it over to Dr. Carter.
Good morning, everyone. Thank you, Madam County Executive, especially for your leadership. Thank you, Dr. Golson, for your partnership. I couldn't do this without you. I just want to say that, and I love to thank our Prince Georgians because they've done such a remarkable job, as the county exec said, at keeping themselves safe. You all keep yourself safe and healthy, and I really, really, as the health officer, appreciate that, because this COVID-19 virus has been stubborn, as you all well know. It behaves like viruses behave. It tries to find a way to stay alive, and it tries to keep mutating so it can stay alive. So we've got to use all our defenses. It's really critical right now that we do that, because the winter surge of this virus is upon us. Now, let me just tell you about some of the cases. Recently, as the county executive said, the state has delayed our countywide case data retrieval. However, we know the spread is increasing rapidly. Now, how do I know that? Well, we know that the cases in DC and in Northern Virginia, as well as in our surrounding counties and surrounding states, are increasing, and they're increasing rapidly. In addition, I have, in our health department, we have a unit that does the contact tracing, and that unit has seen an explosion of cases breaking out in the school system, in nursing homes, and in other entities. This rapid rise in cases in the region is making it very difficult for our organizations to function properly. When you get too many cases in one school or a sports team or in a nursing home, it's considered an outbreak. And that means that the chance of spread increases exponentially, and that's what's happening. If more people get infected, the chances that more people will get very sick, and that's my biggest concern as the health officer. Let me talk to you about the Omicron variant. So Delta variant was the dominant strain, and 2 weeks ago, it was at, the Omicron was 0.4 of all cases, so we weren't really worried about it. We said, well, it's going to come. A week later, it was 3%, 3 out of 100. Now it's 73% of known cases that are new cases that are coming on. That means it's spreading really quickly. So we have to be concerned. The state verified that we had at least one Omicron variant in our county last week. So it's no surprise that Omicron, which has been confirmed in multiple places across the state. So that's the first drop in the storm. That's the first drop of rain. We know the storm is coming. As I told you before, this storm is going to come. But the good news about this is this particular storm, we're prepared for it. So when you see these variants and they're so contagious, like this particular one is, you start getting a lot of breakthrough cases. And we're prepared for that too. So if you've been boosted and you've had your vaccine, you still can get Omicron. But that's okay, because preliminary data shows that even if you get Omicron, and you'll get a mild form if you're boosted and you're vaccinated. Preliminary data also shows that the illness is not nearly severe when you get Omicron and you got vaccinated and boosted as you would if you hadn't gotten vaccinated. So that's why getting vaccinated and boosted is so important. When you see a large wave of COVID cases like we're going to see, you'll notice that the health systems will be affected by it. And so when you have large number of cases, especially if you have unvaccinated people and they get Omicron, they can fill up your hospital system. Right now, our hospital system looks pretty good. Our county hospital system's at 43%, and that's pretty good. But hospitalizations are going to rise fast. And right now, they're up 23%. So we have to be very vigilant to make sure we keep ourselves vaccinated, boosted, and keep ourselves safe. On Thursday, there were 116 people hospitalized with COVID-19 in the county. As of Sunday night, the number is up to 145. So the emergence of the Omicron further emphasizes the importance of vaccinations and booster shots. Giving our families every bit of protection available is extremely important. Now, let me tell you about the vaccinations. The CDC says early data shows that vaccinations, especially boosters, are expected to provide protection against the worst outcomes of Omicron infection. Studies are showing the protection is up to 38 times higher when people get a booster shot compared to people who don't. So that's why we keep hammering the booster and making sure that people understand they need to get it. Studies are also showing a booster shot increases your protection against feeling symptoms of Omicron by 75%. So you may get some cold symptoms, but you're not going to get really, really sick. You need to get the booster. The booster shot gives your cells sort of a burst of antibodies, gives your body a burst of antibodies that can further protect you against Omicron and Delta. Vaccines give us the greatest chance of having stronger immunity over a longer period of time. If you've had COVID-19 already and you're not vaccinated, the amount of antibodies you get from surviving COVID alone is not as reliable as the defense you can get from getting a shot. People are getting COVID-19 multiple times. The more that happens, the less likely the natural immunity can keep up with and protect you. Vaccines provide an intermediate load of antibodies into your system, and that lasts a lot longer and protect you a lot longer. So that's important for you to know. You need to be protected. In order to get protected, you need to get a vaccine. You need the booster. You need to have those maximum antibodies. That's why more people need to get the booster shots more than ever now. If you get COVID-19, boosters give you a much better chance of staying out of the hospital. Now, let me tell you about the children right now. Residents 16 and older are eligible for booster doses, and that's really, really great. The 16 and 17-year-olds can only get the Pfizer booster, but the Pfizer booster is one of the best boosters you can possibly get. But it's still, what we have to be concerned of is those children who haven't been vaccinated, they should get at least one shot now. And it's really, really important. The booster shot hasn't been approved yet for children less than 5 to 11, but getting the shot and getting the complete to 2 shots is really important for us to keep our children safe. The FDA and the CDC closely examined safety data from Pfizer's pediatric trials, which involved thousands of children. No serious safety concerns were identified. The nationwide systems in place to monitor the safety of these vaccines have found very rare occasions where children have had severe reactions to vaccine. Now, one of those rare reactions is a heart and inflammation condition called myocarditis. Patients who get myocarditis often feel chest pain and difficulty breathing. Most patients respond well to medication and rest and feel better quickly. But the reality is children and young adults have a greater risk of myocarditis from getting COVID-19 virus than they do from the vaccination itself. Right now, the risk of developing myocarditis with a COVID infection, if you haven't been vaccinated, is 1 in 1,000. That means out of 1,000 people who have COVID-19, 1 of them will get a severe myocarditis. The risk of developing myocarditis from a Pfizer or Moderna vaccine is 1 in 9,000, and that one person is likely to have a very mild form that will resolve very quickly. When patients choose not to vaccinate their children, choose not to vaccinate their children, they run a far greater risk for them developing health issues from the COVID-19 infection than from a vaccine. And that is especially true given this rapid spread we're seeing now. As a pediatrician and as a dad who has 2 children, well, they're not children anymore, they're young adults. But when they were children, I want to make sure that families know the facts. The facts are that vaccines are safe for children and will keep them healthy and alive. The vaccines combined with mitigating the spread can provide the path to a safer and healthier holiday season. So I'm going to repeat this because I say it all the time. Wear your mask. Keep it over your nose. It's part of your everyday routine. Wear it, especially when you're indoors. You have to wear it. Wash your hands. Use hand sanitizer, soap, keep your surfaces clean. Get your family vaccinated and boosted if they are eligible. And when you're around folks, make sure they're vaccinated. When you're having the family gather, everybody should be vaccinated. And the people who can be boosted should be boosted. And if you're not feeling well, you should get tested. You should also get tested if you're thinking about traveling. And shortly before you're traveling, you should get a test to ensure that you're negative. And if you're negative, when you get back 5 days later, you should get a test again make sure you're negative. And if you feel any symptoms, get tested. That's very important. So in conclusion, I just want to say that the science and the message is clear. We have the power to keep each other healthy and alive. I can't think of anything more human than that. Just doing that for each other. Vaccines are free. The tests are free. You don't need insurance. We don't care about your immigration status. We only care about your health. It is heartbreaking to me to know that just a few needle sticks in the arm can save so many lives. If we had that vaccine when we first started, we would have saved a whole lot of lives. So that's why it's really important, and I keep reiterating, you have to get that vaccine. Getting this pandemic under control will take a little longer than we thought, but not that long. So if we do the right thing, we can get it done. Thankfully, we have the weapons, we have each other, and so we just have to stay vigilant. I want to thank you all and wish you all a happy holiday. Thank you so much.
Good morning. I want to first say thank you to Dr. Carter and to Madam County Executive for your continued support of our students and families in PGCPS. I am Dr. Monica Goldson, CEO, and just want to reiterate that it is my job to make decisions based on what is best for Prince George's County Public Schools students, staff, and the families we serve. Over the last year and a half, the Prince George's County Public School community has pulled together throughout the uncertainties of COVID-19. This fall, as we welcomed most of our students back to our school buildings for in-person learning, I know that most of us thought that we had finally turned the page to our new normal. Until the recent national COVID-19 surge, we were pleased that our multiple health and safety protocols in our schools and our focus on vaccinations largely worked. Over the past week, however, we saw a rapid increase in positive COVID-19 cases in our schools. In just 1 week, we had 994 students and 261 teachers test positive, which resulted in us placing 16,778 students and 492 staff members in quarantine. The large number of students and staff quarantines, along with COVID-19 cases, compounded by ongoing staff shortages, began to significantly impact learning and became disruptive to our school environment. This led to the decision that I made last Friday to temporarily shift to virtual learning. While our goal is always to continue in-person learning whenever possible, there are criteria outlined by the Maryland Department of Health for temporary suspension of in-person learning. Those criteria includes evidence of substantial uncontrolled in-school transmission, additional time needed to identify, notify, and exclude close contacts, logistical or safety concerns arising from the number of cases and close contacts, and the recommendations of local public health and medical professionals. When we made the decision to suspend in-person last week, each of these criteria was in play. This is a temporary halt to in-person learning. It is not a halt to meaningful teaching. I still believe that our schools are the best place to be to ensure that nothing replaces the dynamic between students, teachers, and their classmates in our classrooms. I will continue to follow science, and I know that learning will stay in motion. During this temporary transition, we also will support our families and our students. Currently, schools are working with families to ensure that this week and the first 2 weeks in January after winter break go as smoothly as possible. Students who need Chromebooks can pick up one from their school and get tech support from designated staff. We also have several technology supports and resources for families online to assist them in troubleshooting and resolving any issues that may arise. We also know that many of our families depend on meals that are provided in our schools. So our team will continue to distribute meals at schools and will continue to do so in January. Most importantly, I encourage families and community members to get vaccinated. And if you are already vaccinated, as shared earlier, please get your booster shots. The Prince George's County Health Department has been a great partner throughout this pandemic with us. We will continue to host our COVID-19 vaccination clinics in our schools this week and over the winter break. I also encourage families to please register your child for weekly random testing, as this is a highly effective mitigation strategy for COVID-19 that we began at the beginning of the school year and will continue throughout this school year. Registration links for weekly random testing and screening for students are available on our PGCPS website, as well as each school's individual school website. In closing, I want to reiterate that although I believe the best place for students to learn is within the walls of our schoolhouses, my primary responsibility is to ensure the safety of those that I am privileged to lead and serve. I appreciate all of you for your continued support. Have a safe holiday, and I look forward to seeing our staff and our students on January 18th. Thank you.
Okay, so now with that, we will open it up for any questions. Wilt?
Yeah, sure. Let me answer both questions. The first one is, throughout the entire school year, we have had to send small cohorts of students home as quarantine. And so one of the things I'm grateful for is that our parents have been extremely flexible. While the timing of this was not the best, unfortunately, that surge in 1 week, as I shared in those numbers, really is what precipitated the immediate action of my team. If we could have waited to allow time for parents to make those changes and supports around daycare, we would have. But in consultation with the health department, we thought it was important to begin to make sure that our students were safe in their homes, in a way to make sure that when we got to the winter break and for the holidays, that as many families that could serve together. We'll continue to support families as much as we can and know that this temporary change is only for 3 weeks. And so going into the winter break, there were only 3 days, 3.5 days. Parents would have provided that home care support for them during the winter break, and then for the next 2 weeks in January. It, once again, is temporary. Fully understand that request. In terms of staff, as I shared with many of our staff who sent me emails over the weekend, and I worked to respond to each one, in April 2020, we were able to show our community and provide to our employees that it was safe to return to our school environment when we returned in April, when it was many of us were just school-based staff and very few students had opted to take the in-person learning. What our data shows is that the increase that you saw and the number of people quarantined were largely with students. And so we felt comfortable in saying that we could continue to allow our staff to work in their buildings where they have access to all of their resources and to provide evidence to Maryland State Department of Education that teaching and learning remains a priority with us. And by doing that, we've allowed our staff to be in our building safely and also to continue the teaching and learning experience. Thank you.
sorry. Can you repeat it, Brad? I didn't hear the first part of what you said. No, yeah, we don't. I don't believe it at this point is necessary. Again, what we want is for people to use their best judgment, and that includes making sure that if you're entering those spaces, we think is safest for those who are vaccinated, boosted, and who are continuing to test if they have concerns. But we want to make sure that we are doing what is reasonable, and we are in a different position now because, as I mentioned to you before, the majority of Prince Georgians are vaccinated. And so I believe that that it is safe to continue in the posture that we're in. But we'll continue to look at the data as it becomes available to us. As we mentioned a moment ago, we've been unable to get data from the state now because of the cyber attack for the last at least couple of weeks. It's been the last 2 weeks that we've been unable to get the data. And so the concern is that we've all been flying to some extent a little bit in the dark because we haven't been able to get that data from the state that tells us exactly how we're doing on a local level. So we'll continue to review that data. If it dictates that we make a different decision and we revise some of what we're doing, we'll do that to make sure that we can protect our residents. But based on what we saw as of the last time we got the data from the state, it looks like we are in a good posture to continue in the way that we are. Oh, I agree completely with Dr. Golson. Every one of us agrees that it is preferable for our students to be in the classroom. We know that's where they have the optimal experience, and that's why we believe that it was wise, given the numbers that we've seen, to make sure that we take immediate measures to contain the spread of the virus, to make it safe, again, not only for our children to be home with their families during the holidays, but also to make sure that we're doing everything we can to make it safe once the temporary period has passed to be able to return to the classrooms. Hello. No, the state just updated its website as of yesterday. So it's been very little time, but there were a couple of weeks where there was no data provided. And we don't yet know, we haven't heard yet when the county level information will be available. And again, this is because of a cyber attack. We understand that, but as far as I know, and Dr. Carter, we have not received any updates yet about when the county level data will be able to be provided for us. And as I mentioned, that means that when the data came back up, you know, we can look regionally. And so we had some sense from looking at the district and looking in Virginia and other places that we should have expected that the surge would also have occurred here in Prince George's. And that's what we're expecting is when we get those numbers again, we're expecting that it will confirm what we are seeing. And because of the contact tracing, we know that we're in the middle of a surge, but the state has been unable to provide us with the information, except we know as of when they updated yesterday that there was an 89% increase in the number of infections over about the last 7 days or so. So we know we're in an active outbreak. Thank you. I'm sorry, was your question for me or for Dr. Oh, okay, I'm sorry.
Well, I can answer about with respect to the health officers and the health officers working with the state. Yes, we've talked. This is a statewide issue. I don't know how much Dr. Golson has talked to her colleagues, but in terms of the health departments, this is a huge issue, and these are very serious decisions that have to be made, and they do leave it up to the local health department. So they put a lot on our shoulders. I think we are looking at real-time data. We make the decisions to keep our children safe. And other health officers are doing the same thing, working with their school systems and helping guide their school systems to make these types of decisions.
In response to ongoing communication with my colleagues, yes, we continue to converse. And what we all acknowledge and realize is that each school district situation is unique and different. And while I may make a decision for Prince George's, does not mean that that's the same decision that one of my colleagues will make. They fully understand my thinking, my rationale, and the support that I've received from both the health department and my county executive in making the decision that I made. No, virtual learning does not have an impact on snow days. I'm sure the kids would like to know that, so thank you. I, I did. I actually had a direct conversation with the state superintendent, shared our issues and concerns here, and received a response from him in support of the decision that I made.
There has been a large demand for testing statewide, nationwide, as you know, in the test kits, we have test kits we've been distributing at the library, and we feel that we're in pretty good shape in terms of testing, but I can tell you because of the increase in the Omicron virus, how it spreads, testing demand is going to go up, we know, sharply in the next several weeks, so we're keeping our eye on that and working diligently to make sure we can cover that.